So, welcome everybody. For those of you who don't know me, I'm Dr. Gat. I work with John Yadegar and the staff, and I do the psych evals for them and occasionally do these support groups, so I'm glad you all came. I know this is a very intimate topic, so kudos to you for coming. What I wanted to start with, because this topic is so, for lack of a better word, intimate, right? I wanted to start us out, and really we can expand this topic to a lot of stuff, and we don't have to talk about, when I talk about sex with my students and I teach human sexuality to college students, well, they like to talk about it, you know, they could talk about it, you know, for every second of every day, right, at that age, but it is something that's very personal to all of us. Sexuality covers not just the act itself or the physical part. It covers a lot of other things, right? Relationships, how we feel about ourselves, our self-esteem, our body images. So that's why I think this topic is really apropos to, you know, anyone, and especially maybe weight loss patients, because some patients do have issues with their eating and body image and things like that, and that's what keeps us sometimes hooked into bad habits. So this is something I teach my students. This is Sternberg's triangle of love, and it's one of the best definitions we have of love. So before I tell you what his definition is, and you have a little bit in front of you, if I asked you what is love, how would you define love? And I'm talking about intimate love in terms of not just love for a child. There's all kinds of love, right? But when we're talking about a partner or monogamous relationship, whether that be with the same sex or opposite sex, someone that you're committed to, what does it mean when you say to someone or you say to them, I love you? How do you put that into words? They asked 5-year-olds, you know, what their definition of love was, and I was just thinking about what you said about the unconditional love, and I think one of the wisest ones, and this is a 5-year-old, said, it's when you're afraid to tell somebody something about yourself, and you go ahead and tell them, and they love you even more for it. Is that not wisdom? And that's love, you know? And then another 5-year-old responded, it's when you share your French fries with someone and you don't want them to share their hamburger with you, or something like that. It's sort of the unconditional giving without expecting anything back. So, you know, and these are 5-year-olds, so that to me is amazing. So Sternberg, because it's so hard sometimes to define love and put sort of a grasp on it, he took love and he made this beautiful triangle out of it. He talked about these 3 components to help people kind of get more of a way to talk about it concretely. And it has passion, intimacy, and commitment. And so passion part of it is really the part of our relationship that is the spark. It's where, when I tell my students this story, it's where you're standing in the line at Starbucks and there's somebody in front of you and there's just something about them. And you don't even know their name, you haven't even had a conversation with them, but there's something about the way they look, or the way they're looking at you, or the way that they're just standing there. So you guys take yourself back when you were teenagers, right? So sometimes we would meet someone and they would be like, oh, you know, there's just something about them. And sometimes you couldn't put a finger on what it was. So the passion part has to do with our physical part. And it also has to do with the sex part of it, the intimacy, the physical intimacy. And so that's often the part of the relationship that gets you motivated in terms of really trying to connect with someone and trying to get to know them. And that generally happens, you know, sometimes when you're young in a hormonal age. When we get older, sometimes relationships, as we know, they change. And with time, relationships change. The intimacy part, according to Sternberg, is the part of the relationship that is the friendship part. And this is where you really get to know one another. where you know what their likes and dislikes are. You know, they get to know you. You feel like the person you're with really is interested in you. You're interested in them, what their goals are, their aspirations, and their dreams. And some of the best relationships are ones that are built on friendship, right? We all know that. So it's not just the physical part of the relationship. What might Sternberg think about commitment in a long-term relationship? So you need the passion and the intimacy, right? You need the friendship, the physical attraction, depending on how important that is to you. Commitment is a cognitive choice. Very nice. All of you guys are correct. So that's the cognitive piece of a long-term relationship. And according to Sternberg, it is not based on feelings. So, and I've done plenty of couples counseling. I tell couples, even if you are in the best relationship on earth, there are going to be days, come on in, where you look at the person next to you, and you can be so in love with them, but there are going to be mornings when you wake up and you think, oh my God, don't even touch me this morning. Or I don't want anything to do with you this morning. That is normal in any relationship. Exactly. That's exactly what Sternberg is referring to. So just to reiterate, the passion part of this again is, well, let me start, the passion part, is the physical part. It's where you're attracted to someone physically. The intimacy is really the friendship part, and the commitment is the decision to stick with someone through the thick and the thin, right? The times where, you have quirks. And what happens in relationships over time, as many of you have probably experienced, is that at first the physical might be the most important driving force, right? You're physically attracted to each other. There's a lot more of the sexuality going on. With time, usually that subsides, and it's more about the friendship piece and the commitment piece. And the friendship takes a more driver role, and the intimacy, not that the passion is still there, but it may wax and wane depending on how, having kids, stress, after surgery, right? I mean, there's all kinds of things that interfere, or when people are on medications, those types of things. So that's what I kind of wanted to start out with. And then there are things in between here. I'm not going to go into a lot of detail, but for example, sometimes relationships have two of the components and not all three. If you have all three components, you have something called consummate love. Consummate love is all-encompassing love, meaning that you have a balanced relationship with all three of them. For example, if you don't have the physical part, the passion, and you have intimacy and commitment, that's more what Sternberg refers to as companionate love. That means it's more of a friendship. Because I love a lot of my friends, but I'm not physically involved with them. It doesn't mean that if you have a relationship like that long-term with a spouse or a significant other, and you don't have the passion part of it, it doesn't mean that if something's wrong with your relationship. And I want to be really clear about that. Sometimes two people feel like that's not an important part of their relationship. Other people have different kinds of wants and needs with that, and it's really important to communicate about that. We can talk more about that a little bit later. I know that that's something that's very personal to people. And so that, that depends on what the two people work out together. We live in a society where we are bombarded with sexual messages, are we not, right? Sex sells. Sometimes I think the message is if you're not having sex on a daily basis, something's wrong with you. And I think the message is one that is not oftentimes reality. I think sometimes, especially when I teach this to my young college students, I say to them, please don't let what you see on TV be your role models for what to expect in a relationship, because oftentimes it's not reality. They have a fight and they make up two minutes later and everything's fine again. That's not always how real life works. You know, and also when you go to have that first kiss or that second kiss, your noses are going to bump, and it's not going to be like in the movies, and it's not going to be perfect, and you're going to be awkward, and things are going to be awkward. And so, you know, again, we have to really be realistic about what happens, I think, behind closed doors. Intimacy and passion without the commitment is really more of the, my students call it these days, what is it, they call it friends with benefits. I don't know if you guys have heard those terms. Yeah. All right, so I learned a lot of these hip terms from my students. So we all know what that is. And so usually those don't really work out really well, unfortunately, fortunately, whichever. So I always tell them to be very cautious when they get into those, that, you know, if you're invested in your emotions in those and feelings, to be very careful with that. And then passion and commitment without intimacy is something called fatuous love, F-A-T-U-O-U-S. That's empty love. Because if you don't have that friendship, then you are not connected. One of the things that I found was there is I found one study that was conducted on bariatric patients, and it was only conducted on women. It was changes in sexual functioning and sex hormone levels in women following bariatric surgery, without going into all the nitty-gritty. Basically, what the results concluded was that women who underwent bariatric surgery had significant improvements in overall sexual functioning, in their reproductive hormones of interest, meaning that their testosterone, serotonin, all these things are involved with sexuality, estrogen, progesterone, were more at normal levels, so that their sex drive was to more of a normal level as before, compared to prior to surgery. And psychosocial status, which meaning improvements in things like depression and other kinds of psychological indicators that all play a role in sexuality. So I know that this is a very intimate topic, and the thing is that I'm very comfortable with it. And so I could talk about sex standing in line at Starbucks, so I have to watch myself. So I have to remind myself that for most people, this is not a comfortable topic. And so we can talk about anything in terms of just relationships in general, questions you have. We're not going to assume that if you throw out a question that's about you personally, it could be about your aunt that lives 3 states over. You know, have you all noticed, or is anybody willing to, you know, and again, your name and your voice won't be on the camera at all, but have you found that you feel better about yourself? Have things changed in your sexuality, or even just your relationship, your communication post-surgery, anything? You know, I think people out there in video land want to hear about some positive changes, maybe some things that we're still struggling with. I mean, we're all humans. You know, it's really interesting to me that I teach this subject, and people often think, oh, well, everything in her sexual life must be great. I'm human too, you know. So we could bring my boyfriend here, and I'm sure he'd have a thing or two to tell you about things we've had to communicate about and work through. I mean, it's normal. It's absolutely normal. This is an issue that is, again, people have different drives and different needs. And so they often, you know, it's the second biggest issue in relationships. Does anybody know what the first biggest issue? Very good. So it's money first, and then sexuality second. So there's a couple of things we're talking about. We're talking about the physical and the psychological. So in terms of the physical, the chafing, that kind of a thing, there's always lotion and things like that, of course. Considering maybe surgery down the line, if they a tummy tuck, those kinds of things, if they want to do that as well. So, and then there's a psychological aspect of it as well. But I think you all have a great point. If you feel good about yourself, you can talk about with your partner. I think it's important to bring up. I think communication is key. Even if you're afraid to bring it up, I think the most important thing is to say to your partner, does this bother you? Because you might assume something and it may not be bothering them. So. It does take time. And so that's something that you can work on in your own body
Yeah.
image, and also, but it may or may not be an issue for your partner. Has that been, has somebody had, or have friends that have been through the surgery where their partner has had issues with that? And some things that you can talk about in terms of, why they're having issues, and there's always couples counseling as well. I think that's really, really important, really important. But I think it begins with yourself. But that's so important, you guys. What happened? We often make assumptions, right? And then we check them out and they're not true. It happens all the time, and especially in relationships, Sometimes women don't see that, and they think, oh, he doesn't send me enough flowers, or this or that, or taking me on dates. But guys are doers often, and that's the way they show love. They'll fix stuff, they'll do stuff, and that's how they show love. Oh, I love that! Very nice. Very nice. Hey, who's single in the room? Okay. Do you find yourself getting more looks from guys? It could be both. When you're 105, it will stop. Enjoy it. I think it's wonderful. Well, okay, so first of all, I'm going to, because I teach human sexuality, there are many ways to take care of that. And I told you guys, I'm very comfortable with this topic. So there's the big M called masturbation. So, and I know everyone, oh my God, you can't talk about that. Well, I can talk about it. Okay. All right. So that's one way. Now, the other thing is, when will it stop? I hope never, because that's a wonderful drive to have. You know what? It probably will with time, but you're still young, and that's very, very normal. Especially, I think, now that you're probably starting to feel better about yourself. So enjoy it. You want to be safe, of course. I'm not having to, I just say that because I teach young students. I'm used to just saying that. But so it probably has to do also with, I don't know if you were here, you came a little bit late, but studies do find that after surgery, people's hormones levels bounce back to more of a normal range. And so you're probably back in the normal range, whereas before it might have been suppressed even somewhat. And it's probably psychological as well. So kudos. Enjoy it, celebrate it. So, and I know it could be a little frustrating sometimes, but there's the big M. Just remember, Dr. Gat said the big M. Enjoy it. You know what? Set up, I think boundaries are really important. Thinking about how quickly and how much you want to progress and how fast is really important, I think, to set. Because sometimes in the moment we forget those boundaries that we set for ourselves. So, and I'm happy to talk with you also one-on-one about that, but yeah, it's terrific though. But I think thinking about too, what is it you want, and if it's something, if you right now just want to date around, I think that's terrific. Again, we want to be safe. There's all kinds of things out there that we don't want to catch. We don't want you back in the hospital for other reasons. But kudos to you. And I think also, if you're looking for someone long term, they're going to understand your timeline. And they're going to be there. Or am I not right? Seasoned people who have been right? Okay, respect one another. And there's something called, communication and compromise as well. I think you guys should be proud of the fact you chose to have the surgery. I think it takes guts to decide to do this. And the people that say, oh, you took the easy way out, you know, I got news for you. This is not easy. It's a gift of self-love, you guys.
Exactly.
I mean, to have good self-esteem and you care enough about yourself to have it. Although sometimes when I do sex therapy with clients, I tell them, especially with couples, if they're not making time for that, and it's an important part of their relationship, you actually have to schedule it in. They're like, oh no, that would be not spontaneous, but otherwise it's not going to happen, right? Between the kids and the this and the that, and you know, you have to schedule a time. Pretty much. Well, you don't have to put it on your calendar for the whole family to see, but yeah, you definitely have sex dates. But a lot of couples, when they have kids, they don't make time for it, and their relationship starts to fall apart. And then what happens is, you know, their kids consume their lives, and they lose that part of that relationship called the intimacy and the friendship part of it. And they start to lose touch with each other, and they grow apart. And then the kids go off to college, and they kind of are left looking at, who is this person I'm with? Oh, great discussion, you guys. I love it. I'm glad you guys came, especially with this kind of topic. We weren't sure how many people would come, but it's really nice to have you guys here because I know it's going out on a limb. But you know, even you guys, I think being here for each other is really important, right? I mean, operating in a vacuum, when we get in our heads, don't we create crazy messes sometimes? So, yeah, it's important to be here.